that's a lot of why, the Miles Hall Foundation is focusing too on culturally responsive care, right? And making sure we have resources. And that kind of segues in to our next part of our conversation is what is out there for you? What resources are there for families when they need them? Because I will tell you right now, um, we did not have those. We had no resources. I mentioned earlier, we had called, I saw Miles, having issues with mental health challenges, trying to get Miles help. There was all these things that he had, there were other criteria that he needed to met to be. And when I was seeing that his delusions and hallucinations, he was knocking on doors and, you know, like we had got Miles help probably 9 months before, utilizing the police. And able to get him like hospitalization and getting him on an injectable medicine, we saw like night and day what that can do, right? So resources are important. Resources are critical. And resources are especially important for someone who can have medication management, right? And that's what we saw with Miles. We were able to get him help 9 months before. But unfortunately, the day before Miles was killed, seeing all the signs, the delusions, hallucinations. So we call, and I call the non-emergency line, right? Because Miles is not in an active like mental health emergency. We're trying to avoid that. So we call the day before. I speak to someone on the call from the non-emergency line. They're like, oh yeah, for one, they don't give me any resources. They don't say, hey, there's a mobile crisis unit you could call. They didn't even tell me that, right? So that would have been number one, good to know, right? I already knew that, but the fact of that you call, they are not even giving you that as a resource. There was one mental health, there in our county of Contra Costa at the time, there was only two mobile crisis units for the whole county. And those mobile crisis units were Monday through Friday from 8 to 5, right? So this is what, Friday night at like 8 o'clock. There's no one to come, right? So there is a resource now that and that was created with the Miles Hall Foundation, Rebecca Bauer Can, Assemblywoman, Assembly member, and other advocates throughout the California. And that's called AB 988, the Miles Hall Lifeline and Suicide Prevention Act, right? So that's now a number that we want to make sure all of you guys are aware of. 988. I don't know if Dr. Jones or Rachel, you guys want to talk a little bit about 988 or what that is?
Yeah, I can talk about 988. So I think you know a little bit more about me since you helped get the bill, but from a layman perspective, being on the policy side of it, and supporting like my niece, who I told to call 988 recently, I see it as a resource that a non-emergency resource if you're experiencing suicide ideations or it's a non-emergency line. If you're having an emergency, call 911 uh, if you so choose to, but I recommend that you try to call 988. And my niece recently called it and she was feeling lonely and suicidal. And she said that they were able to talk with her. And, she's already in FSP. So, um, and I think that that's why the importance of community-based resources. So having the crisis continuum, when I teach about the continuum, the 988 is a part of, a phone number that you can call. Um, and it's a network. So it's if you don't get someone in California, you're gonna get someone. Someone will answer the phone across the world. And Tan has led, a part of that and making sure that it's a part of a nationwide network. So I think that that's as much as I know from, and there's, peers and and then there's the warm line as well. That's the
Yeah.
ones that are run by peers. for folks needing resources as well. I don't know if Dr. G or Ty wants to add anything about 988 from
Yeah, I mean, thank you for that. I mean, I would just say, right, you not if you someone's having a heart attack, right, you call 911 because you need the medical help, right? But when someone having a mental health emergency, the shift is that we're calling a mental health provider, right? We have someone on the other line who's going to have experience and is going to be able to help. Right. So I think we just need to think about and also another, I think a big misconception about like calling 988 or you don't have to be in the worst moment of your life, right?
hmm
It is there to be able to help you before a crisis becomes an
mm,
emergency,
hmm
right? So for us, like we were doing that, right? When we called the day before, but there was no system in place for us. Right. So now there is 988 for people because people call me all the time. I have friends who are having, challenges with their sons and kids and like what do I do, right? Like start with 988 because at least they're going to have some resources for you. Yeah. And, I don't know. So what do you do when you call, right? Who's going to answer? Someone's going to call on the other. When you call them, call 988. There's going to be a trained counselor on the other line. Someone trained in crisis intervention, right? So that's important, right? They're there to listen. They're there to help calm the situation. They want to understand why. Is anyone in immediate danger? How can we best help you? Right? We did not have that when Miles was in a mental health emergency and he was in a crisis. He should be here today, right? The system failed him. It failed our family. Miles wanted to live. He had a bright future ahead of him. He was a kind person. Not that someone who's kind, everyone should be able to have equitable care,
Yes.
right? But I just say that because Miles literally would not harm like a spider, right? So then the counselor is going to be able to be on the line and find out what's going on. And and they're going to be able to, a lot of times they're able to connect the person with resources that they need at that moment, right? But then if they don't, then there's A3, right? A3 is going to be able to, and that's like someone to call. So it's called anywhere, any one anytime. So there's it's a continuum. Rachel keeps talking about the continuum of care, right? Calling someone, getting help, and then, someone to come and then somewhere to go, right? So a continuum of care. But that's where A3 in our county, Contra Costa County, comes in, right? And that's called the Miles Hall Crisis Hub. So if you call A3, they actually answer the phone, the Miles Hall Crisis Hub, right? Because they want to also understand and how they can help someone in a mental health emergency, right? Now this person's thinking it is a crisis. What can we do? How do we get this person help? Right. So it's someone instead of police. And that is our mission, right? Our mission, because our son was killed by police in a mental health emergency. So right. So the work that we do is all about education. It's all about making sure people understand resources and knowing maybe what to do. But now at least having 988 and A3, it's a way to get people help.
Can I
Um,
also just add to that time
yes,
that
please.
by no means is this a an indictment on law enforcement. Instead, it is a resource to further support law enforcement. So they are busy, they have a lot of things to do, and they need to respond quickly. And it is not, we're all humans, we live in a flawed world. Humans are flawed, so people do things that are harmful, and racism exists. That's a fact, full stop. When it comes to A3, when it comes to 988, these resources were developed to ensure that what happened to the Hall family does not happen to anyone else, and to ensure that those people who are most impacted, who struggle the most, disproportionately or least likely to obtain or receive the services that they need have a solution. So I just want to highlight that because a lot of times when we have these discussions, sometimes people will say, well, you have feelings about police and things of that nature. That's not the case. My whole street is full of first responders, and they know exactly where we stand when it comes to mental health and medical emergencies and or physical emergencies. Those are two very different experiences, and they need to work together,
Yeah.
truthfully, in tandem with one another for true healing and wellness to occur.
Thank you for mentioning that. I think it is important, you know, that people are in the right lane, right? And police need to be in their lane, dealing with criminals and people who, and obviously we don't want anyone being killed by police at all in any circumstance, right? Whether they're the awful person or not, right? But I mean, mind you, Miles had a garden tool when he was running in his neighborhood in the bright sunny day in our neighborhood, right? Like, and they even knew, right, when the police were called and they came, they knew for Miles from 9 months before, and they knew he had mental health challenges, right? And they knew he had been working with the mental health officer and trying to get him help. But it didn't matter, right? And it didn't matter because the day, that he needed help, was unfortunately the day he was killed. And that's what we're trying to avoid. We want to avoid non-police um, when people don't need to be there, that when police don't need to be there. So, so the day before we called, it would have been amazing. It would have been, Miles, it would have been a very different situation if we had an A3. Um, so we want to make sure, you guys know that. We also have, we're going to be sharing our resource directory with you guys. We'll be emailing it to you. But then there's also, it's called the Right Response Directory. And that's um, you can Google that, and Shamaha probably put that on in the chat as well, the Right Response. So it can be anywhere in the United States. You can put in your zip code, and it's going to tell you all the non-police response locations near you. So that's also very important, right? You also can call 988. You can also call 988, and hopefully they'll be giving you resources. But if you are looking for a non-police response, that is another excellent way to get um, someone who's not police who's going to come and um, and respond. Yeah. So I don't know. Did you either of you guys have any more to add about resources?
I love the resource sharing that's happening in the chat. So thank you to those of you who are putting that in there.
Right.
And it actually triggered a memory for me that part of why 988 was so important is because we have phone numbers for non-crisis responses, but in an emergency or in a mental flooding where you are not able to think or go to a computer or Google on your phone, 988 is easy. It's something you don't have to think about. You just press those three buttons and you see it in the community. I'm seeing it more 988 signs around the various downtown areas. But thank you all. If you have other resources, feel free to share them in the chat as well.
Yeah, no, thank you. Thank you, Dr. Jones. I appreciate that. Um, yeah, and I think, just a reminder, right? You don't have to have all the answers. You don't need to know everything, right? But like she said, having this easy 988 number is so it could be a life changer. It could be, literally the between life and death, right? So, yeah. And a lot of families don't have to wait. Like, if you're afraid, you can also just talk. And someone actually put in the chat, you can text, right? So that's also a really cool thing. If you don't want to talk to somebody and you just want to get some advice, texting, that's kind of cool, right? To be able to have that as another resource.